Hey, how you doing? I'm Dr. Brian McKay at Core Health Darien, and what I'd like to talk to you today about is a home-based program for peripheral neuropathy. And I think if you have peripheral neuropathy, chances are you know about it, but you probably don't know some of the nuts and bolts about it because it's a pretty painful condition that affects many people who are diabetic, somebody who's been exposed to toxins, people who have long-standing alcohol abuse or use, and all chemotherapy patients. Those seem to be the majority of people who get it. They say it affects over 20 million Americans, so it's a pretty big problem. And right now, the main way of treating is taking Lyrica and gabapentin. Those are the primary ones. And those type of medications are really anti-seizure medications. And if you talk to someone who's taking those medications, sometimes the cure is worse than the thing that's killing you. So what I want to start out is first of all let you know we offer a home-based therapy program. It's really a wonderful program because the therapy is done at home primarily, and that allows us to get pretty good results because we have people doing therapy twice a day for themselves once we train them how to do it. So it's a really good system, and it does offer relief. And we're seeing some pretty solid results that one we're excited about because this condition is like one of these dark alleys. You know, you have it, take the medication, and you get worse. And one of the problems I see is that people become more sedentary. So there's a vascular component to peripheral neuropathy as well as a nerve, neuro. So there's a nerve component as well. And so what our program does is addresses the vascularity by doing a home-based therapy where you use this light boot on the foot, and it stimulates production of nitric oxide, which is a vasodilator. So it opens up the blood vessels. That's what a dilate is. Dilate means to open. So it's really good. But when you can do it at home twice a day, and the other part of the core part, well, there's a nutritional part, but there's also another home-based therapy called Rebuilder. And the Rebuilder is it's a certain current. You're in a foot bath with these currents in the bath, and what happens is it makes a healing environment for the nerve, because when you have neuropathy, a lot of times the covering on the nerve gets eaten away, and as the covering on the nerve gets eaten away, you have interference with how the brain communicates with the body part. So you have to think about it as like the peripheral nerves, the nerves on the outside of your body, outside the central nervous system, and it's a communication link, I guess, between the brain and spinal cord through these peripheral nerves. And so when it's interrupted, people are going to have a lot of different, let's just go this way. Try to think of the nerve as the loss of signals. I like to tell people it's like when you have a phone, if you're old enough to remember a phone off the hook and that loud beeping sound that just doesn't stop. Well, that's what the nerve is looking to transmit information, but cannot transmit the information. So the brain keeps looking for it. It's a painful event, or you think about something like static on a telephone line and, or a wavy telephone picture. That's a good way to think about it because the brain is just not getting what it needs. So the symptoms can, be mild at first, and then they can become disabling. And there's the different type of fibers that are involved. You see, the good thing is, unlike nerve cells within the central nervous system, the peripheral nerves are known to continue to grow throughout life. So when these nerves are damaged, we can intervene with these home-based therapies in order to make a difference in neuropathy people suffering it. So just to go into it, there's a couple different types of nerves. Okay, you have motor nerves that go to muscles, and they're under conscious control pretty much. You're walking, grasping, touching. Well, actually, sensory nerves would be the sense of touch. And the sensory nerves transmit information such as light, touch, temperature, or pain. And that's the painful part. So you're having a lot of people have experienced really wicked leg pains and leg cramps. So leg pains are coming from your sensory nerves, whereas the cramps are coming more from the motor nerves. So it's a really double-edged sword, which is why we have to attack it, having two home-based therapies. Now, you also have another type of nerve called autonomic, and these control the organs. It's not something you think about, like digesting food or how your heart works. But it affects the nerves, and what happens is these neuropathies uh, really are what we call them length dependent. So what happens is because it's not only just the legs, it's also the hands that people start to lose touch in. It means the nerves that are furthest away are where the symptoms develop first and are worse, and then they kind of spread closer to the body part. So when you have motor part, you can have weakness. And sometimes people feel the muscle fasciculations where the muscle is just uncontrollably twitching. And when that happens, you start to sit down a lot more often. You're not as sure on your feet. There's a thing some people call like a stocking gloves paresthesia, where you feel it in the hands and feet, and this is where it's going to go first. And again, this happens to a lot more people than you really think about. Sometimes it's due to injuries. Diabetes is probably the leading cause of neuropathy in the United States. And it's up to 60 to 70% have some form of neuropathy who are diabetic. Now, people who have vascular issues, and that's what the infrared light boot therapy does, addresses the vascular and the blood problems because it decreases the oxygen supply to those muscles and also the peripheral nerves. Smoking doesn't help. The stuff that's going to narrow the artery, like a poor diet. Oh, by the way, I'm leaving out the nutrition component. There are several supplements. I mean, a lot of them are the B vitamins that have been shown to be very helpful in conducting nerves and healing nerves. So the thing is, the peripheral nerves can be healed. There's also autoimmune diseases, like you have Guillain-Barré, you have AIDS, HIV, and any chronic inflammatory condition is a hormonal is a type of disease is also affected. So and let's touch upon the alcoholism or the overconsumption of alcohol. They damage the nerves, and the diet is typically poor, and those people are susceptible to peripheral neuropathy. Um, the people who are on chemotherapy get an awful lot. The chemo, the toxins that used to kill the cancer pool in the body, and they interfere. They end up killing up the nerves in a pretty devastating way. It's bad enough to have cancer, but now you're immobile. And I see the immobility as a big part because uh, typically you're going to see an older population having peripheral neuropathy. So with peripheral neuropathy affecting the older population, more likely to fall. And that is a serious, serious problem. Um, there's certain tests you can do, needle EMGs, where they put a needle into the muscle, and nerve conduction velocity studies. And these are kind of painful studies to undergo. They're also very expensive. So when we came up with, a home-based program, um, it's really kind of life-changing because people are starting to get their lives back. And we have a number of testimonials, and I'd be happy to share them with you. But we run a number of workshops in the area. This week, for example, we're speaking at the Norwalk Senior Center. Next 2 weeks, we're speaking at the Darien Library. So we do a lot of presentations, but we also do one-on-one evaluations. And we also do workshops in the office on a weekly basis. So the idea is if you get yourself educated about neuropathy, what I like to call it is neuropathy hope and help, because there is hope, there is help. It's not a quick fix. It's not going to be overnight that all of a sudden you're going to reverse out. And I'm not one to say or claim that we're going to cure neuropathy. We try to say is we're going to reverse the effects of it, and they do a pretty darn good job at doing it. So if you have neuropathy, and a lot of people are going to have it, it's the type of thing that you'd be better served by pretty much giving it a shot. Come in here, find out what in one of our workshops. You can reach us at, I'll leave the number up at the end, 203-656-3636, 203-656-3636. And come in. There's no charge to come in for the workshops, by the way, or where we speak at these different areas. Come in and find out, because to tell you the truth, very happy with the results. We also recommend physical therapy to get the mobilization going, because you get a muscle that's no longer as damaged as you start to reverse out the neuropathy. You really have to think about how to get that person mobile again. So we have a physical therapist on staff that we use that. We highly recommend they use it, because there are certain therapies that we have found that we can do in the office to aid and further speed up the healing time for the neuropathy patients. So if you don't have it, then hopefully you learned something by listening to this. If you do have it, give us a call. It's 203-656-3636. The office is called Core Health Darien. I'm Dr. Brian McKay, and we're located on the Post Road in Darien. And if you're familiar with, we're down the block from Trader Joe's. We're in the same building as Quest Diagnostics and M&T Bank. So again, give us a call, 203-656-3636, and come see what we have to say, because there's no charge. It's a wonderful program. Is it right for everybody? No, but we do a quick test and we'll let you know if indeed you do have peripheral neuropathy. So thank you for listening. Feel free to share this. If you have any questions, number 203-656-3636. I'd like to thank you for your time, and hopefully we can help you. Have a great day.